My name is Deanna Pantega, and this is my professional capstone project for Grand Canyon University. Welcome to the presentation on healthcare-associated infections, or for short, we will call them HAIs, particularly focused in the surgical intensive care unit, or for short, we will call it SICU. HAIs are infections that patients acquire during their healthcare treatment, which are not present or incubating at the time of admission. The SICU is a high-risk area for HAIs due to the critical condition of patients and the prevalence of invasive procedures. Addressing HAIs is vital not only for improving patient safety and outcomes, but also for enhancing the overall quality of healthcare. Additionally, preventing these infections reduce healthcare costs by preventing prolonged hospital stays and readmissions. Now let's discuss the problem statement. The high incidence of healthcare-associated infections in critical care, especially within the SICU, is alarming. Patients in this unit are vulnerable due to their critical conditions, invasive procedures, and weakened immune systems. This issue is a priority for intervention because HAIs adversely affect patient outcomes, increase mortality risk, and lead to higher healthcare costs. The primary target population for intervention consists of critically ill patients in the SICU who face significant vulnerability to infections. In addition to these patients, our interdisciplinary care team includes physicians, nurses, respiratory therapists, and infection control specialists. Together, they tackle unique challenges such as the high frequency of invasive procedures, extended hospital stays, and complex medical needs. Coordinated infection prevention efforts among multiple team members are essential for effectively protecting these patients. Next, we have our PICO question. The P refers to the population of critically ill patients in the SICU. The I represents our intervention, which is the implementation of a comprehensive infection control program. The C stands for the comparison group utilizing standard infection control measures. Finally, the O denotes our desired outcome, which is the reduction in the incidence of healthcare-associated infections. The PICO question is critical for guiding our targeted evidence-based intervention. My literature review revealed several key findings on effective infection prevention strategies. First, hand hygiene has consistently been shown to significantly reduce HAI rates across various healthcare settings. Environmental cleaning is also essential as it helps eliminate pathogens from high-touch surfaces. Additionally, having adequate staffing ensures that infection control protocols are maintained, while surveillance programs allow for the early detection and targeted intervention of HAIs. These findings emphasize the need for a comprehensive, multifaceted approach to infection prevention. The Health Belief Model, or HBM, serves as a theoretical framework for guiding behavior change within the SICU. Key components include perceived susceptibility, which emphasizes high risk of HAIs in the SICU patients, and perceived severity, which highlights the serious complications associated with these infections. The model also addresses perceived benefits, reinforcing the effectiveness of infection control measures, while acknowledging perceived barriers, such as time constraints in the busy SICU environment. And lastly, cues to action, like reminders and feedback, will also help promote consistent adherence to protocols. Now let's discuss how we will apply the health belief model to our program implementation. To enhance perceived susceptibility and severity, we will educate staff on the risk of HAIs. Highlighting the perceived benefits will show how adherence to infection prevention practices can lead to the improved patient outcomes and safety. We will also work to reduce perceived barriers by ensuring resources are accessible and protocols are streamlined. Finally, regular reminders and visible hand hygiene stations will serve as cues to action, encouraging consistent compliance. My proposed solution is the Comprehensive Infection Control Program. This program includes several key components. First, I will enforce the hand hygiene protocols through mandatory compliance checks and increase access to hand sanitizing stations. Second, environmental cleaning standards will ensure routine disinfection of high-touch surfaces in patient care areas. Third, staff training and education will be essential with regular workshops on best practices. And lastly, continuous monitoring and feedback will help reinforce these behaviors, ensuring that our intervention is effective and sustainable. An effective evaluation plan is crucial for measuring our intervention success. In the metrics for evaluation, we will monitor HAI rates to assess the effectiveness of the program. Compliance rates, particularly regarding hand hygiene practices, will also be tracked. Additionally, we will analyze the cost effectiveness of the intervention compared to treating HAIs. The methods of evaluation is data collection that will involve using electronic health records and incident reports. We will also use regular audits and staff feedback surveys to provide valuable insights into adherence, while a longitudinal study design will help us identify trends over time. The dissemination plan is vital for sharing our findings and successes. I will target key professional organizations, including the Association for Professionals in Infection Control and Epidemiology, the Society for the Healthcare Epidemiology of America. Conferences like the APIC Annual Conference will provide platforms presenting our results to a broad audience. Additionally, I will submit our findings to respected journals such as the American Journal of Infection Control to ensure our work contributes to ongoing conversations about HAIs and the best practices. For continuous learning, I plan to engage with the latest developments in infection control and evidence-based practices. Attending workshops and training sessions will enhance my understanding, while subscribing to leading journals will keep me informed about emerging research. Joining professional organizations will provide networking opportunities and access to resources, including conferences that focus on infection control and trends. Collaborating with peers on research projects will further enhance my knowledge and practical applications of new findings. In conclusion, the Comprehensive Infection Control Program is essential for addressing the high incidence of healthcare-associated infections in the surgical intensive care unit. This intervention not only aims to reduce HAI rates, but also enhances patient safety and the quality of care provided. Expected outcomes include improved adherence to infection prevention protocols and significant cost savings for healthcare facilities. Ongoing evaluation is crucial for continuously monitoring the intervention's effectiveness. By adapting the strategies based on data, we can ensure the sustainability and long-term success of our efforts to improve patient outcomes in the SICU. Thank you for watching.